Today we'll talk about the defibrillator in detail, and this will be useful for both undergraduates and postgraduates. So to talk about the defibrillation, first we have to talk, it's been invented in 1950s, this defibrillator, and there are totally three types of defibrillator. One is biphasic, monophasic, and another one is called as AED, automatic external defibrillator. That AED I will cover it in a separate video. We'll talk about it a little later, because AED is particularly it is for laymen, and that AED is being seen in all the public places, like public gathering places like airport and railway station. You will have seen. So today we'll talk about the biphasic and monophasic defibrillator. So before going to that, what is biphasic and what is monophasic? See, the biphasic is like both the pads will be delivering the energy. So roughly you can go for maximum of 200 joules, maximum 200 joules of energy. Whereas if you come to the monophasic, only one pad will be delivering the energy of roughly 300 to 360 joules can be centered. But the problem here in the monophasic, the external injury is more often seen. And mainly the purpose of a defibrillator is for defibrillation and cardioversion. So make a note of it that don't get confused between the defibrillation and cardioversion. Both of the defibrillation and cardioversion is quite different. We'll talk about it. So coming to the defibrillation, what is defibrillation? It's like simple. It's fibrillating the heart by the external energy. So when to use the defibrillation? Quite simple. Only in shockable rhythm. So what is the shockable rhythm? These are the pulseless and VT and pulseless VF. That's the main thing. So once you see the patient is getting collapsed, and you find the rhythm as a pulseless VT or VF, then you find it as a shockable rhythm, then go for defibrillation. So what is the energy can be used in defibrillation for a shockable rhythm? Use the maximum energy, maximum joules. In every ER and ICU, you will be having a defibrillator. So go to the maximum settings, go to the maximum setting of a defibrillator of roughly 200 joules. Whereas if you have a monophasic defibrillator, go to 360 joules, that's the maximum joule settings. Next main thing is consent. Get the consent. Once you are resuscitating the patient, once you find the patient is having the pulseless VT or VF, the patient is having the shockable rhythm, you know that you have to do a shock, you have to defibrillate the patient. So before going to that, meantime one doctor should convey the patient attendance by getting the consent, because that's very important. And I have to explain the high risk, because sometimes the patient go for recurrent VT, that's the chances, and patient might collapse, and you may need an intubation also. So for that you have to explain the proper high risk. And the third thing is procedure sedation. So what are the procedure sedation? In every hospital setup they have very different protocols, like morphine, like fentanyl, like medas. Most often it is medas. Medas is often given for the procedural sedation. So these are things we will be seeing in defibrillating the patient. So what is cardioversion? So cardioversion is nothing but the converting the conduction of heat by energy. So for example, in case of unstable tachyarrhythmias, what is it's nothing but the organ. If organ perfusion is affected, like if you check out the brain, the patient might be altered. If you go to the chest, will be having chest pain, lung, breathlessness, all those things are seen. So patient will be having heart rate of more than 100 or 150, and based on the rhythm, like common rhythm as the SVT and AF, in that particular rhythm we have to cardiovert the patient. And this is the manicular, and this is the defibrillator. And one more thing, in case of chronic AF, transesophageal echocardiography is being used, and before giving the shock we have to check for the LV clot, so that the clot should not go to the brain, that can lead to the stroke. So now we are talking about the new onset of tachycardia, so that's what we are focusing on. So for cardioverting, there's for a particular rhythm, the particular energy has been used. For example, if it is in atrial flutter or SVT, we can select the joules of about 50 to 100. And if the patient is having the VT with, and meantime you have to check the pulse. If the patient is having a pulse, VT with the pulse, then you should select the energy of for around 100 joules. And the patient is having fibrillation AF, then you can turn the knob and select it to the 120 joules, and you can give the shock. So main thing is you have to press the sync button. If you come and see this defibrillator, what you see is a sync button. Before cardioverting, before giving the shock, and directly you should not give the shock. You have to press the sync button, then you have to apply the shock. The reason why some people will be having the doubt, why you have to press the shock. See, ideally you have to press the sync button because shock will be delivered at the peak of R wave. That's the concept. The machine will analyze the rhythm and it will be at the peaking of R wave, the shock will be delivered to the patient. Then the next question, what in case if you don't press the sync button and if you directly deliver the shock, what will happen? It's very simple. Patient already is having arrhythmias, and if you give the shock directly, if he is in a refractory phase, it will go further and it will cause a cardiac arrest. So these are the complications if you don't press the sync button and if you give the shock. So now we'll talk about in detail of the defibrillator. So what you see is, going back to the defibrillator, what you see is the defibrillating machine. What I'm having in hands are the paddles, and one we have to keep it in the apex and one we have to keep it in the sternum of the patient. And if you're having the doubt, there's a picture in every hospital, in every year, in every defibrillator, there will be a picture on the particular paddles so that you won't get confused. And you find a patient is having a pulseless VT or VF, and you have to select a maximum joules is 200. This is the maximum joules has been set, and before that you have to apply the leads to the patient in the chest. Like for example, the right has go for the patient right shoulder, red color, and yellow color on the left shoulder, and the green color on the apex. So these are the leads color, and once you have connected the leads, then once you found the patient rhythm has been going for VT or VF, and you have to check for the pulse as well as. And as we have discussed before, to get the concern, you have to explain the high risk to the patient attenders as well. And what do you see in this color of this paddles? Now it is showing like a red color. It is nothing but if you keep the paddles, especially at the mannequin, it will show the proper full color. The color will go to the red, yellow, green. Maximum the color will be like green, and what you see in the tick mark, the color will rise up to the tick mark level, which means the paddle is adequate. The entire surface, paddle surface has been on the patient body surface area. That's what it denotes. And after selecting the joules, and in case of pulses VT or VF, we don't need to press the sync. You can directly defibrillate the patient, and we have to apply the paddles, one at the apex and one at the sternum, and then you have to give a shock. And before delivering a shock, please ensure that your colleagues, your doctors, your colleague mates should not be in touching the patient or on the bed. So you have to make sure that you have to loudly, you should say that you are clear, and make sure that everyone should be clear. And then you have to press the shock. This is a button of that. You have to press the shock, and the shock will be delivered. Once the shock has been delivered, you will get the rhythm strip. Automatically, the machine will give this rhythm strip whether the rhythm has been changed or not. And once if you found the rhythm is not changed, then you can go to the next shock. So this is for the defibrillation. So coming back to the cardioversion, you find the patient has been SVT or AF. As I said before, there is a particular joules. You have to set the particular joules. For example, 50 joules if I am setting, the energy will be delivering of around 50 joules, and I will be delivering the shock. But before delivering the shock, you have to press this sync button. You have to press the sync button, wait for some time, and then you have to deliver the shock. Because this pressing the sync button is nothing but it will be delivering the shock at the peak of R. That's what that is the concept behind the sync button. And if you don't press the sync button, it's like directly giving the shock at the refractive phase, so the patient might collapse. So that you should be carefully, you have to notice whether the patient is having a pulse, whether it is pulseless VT or VT with pulse, that you have to check it out. And as per ACLS, we have to follow other drugs and other protocols. So these are the basic setups of a defibrillator. Hope it will be useful for both undergraduate and postgraduates. And if you have any comments, if you have any doubts, you can comment in the comment section. And another thing is AED. We'll talk about the automatic action defibrillator in a separate video. A little later, they will get the video soon. And if any queries, you can comment forward. You can ask it in the comments. Thank you. I forgot to mention that. What about the joules for the pediatric? As per PALS, the amount of joules we have to deliver is 4 joules per kg. That is the amount of joules you have to deliver, amount of energy you have to deliver. So for that, this is adult paddles, and one there will be a clip, and if you remove the clip, what you see is the pediatric paddle. This is been used for the pediatric setup, and the formula for this is 4 joules per kg. So that is a thing I have to mention it. So do read about the defibrillator in detail. Thank you.